A common shoulder injury that you are likely to come across is called shoulder impingement. It is called this because there is often an impingement of the structures that cross through the narrow space between the acromion process and the head of the humerus. There is normally associated pain with impingement issues, and people will often have what is known as a painful arc. Painful arc is where there is pain between about 70 to 120 degrees of abduction. This pain can come from the supraspinatus tendon of the supraspinatus being pinched between the acromion and the humerus, or it could be due to the inflammation of the superior joint capsule or inflammation of the subacromial bursa. If your client experiences any ongoing shoulder pain, it is important that you refer them out. Impingement issues can be as a result of a trauma, such as falling on the shoulder, but most typically they occur from repetitive movements that involve internal rotation of the humerus and abduction. In a healthy shoulder, there is sufficient room for the tendons to pass through the subacromial space with no issues. However, when the space has been compromised, it predisposes the shoulder to these impingement issues. The space in the joint is compromised when there is poor posture, particularly if somebody has a protracted scapula and excessive internal rotation, and also if someone has poor control of the head of the humerus and scapula during movement. Overuse and poor technique will also contribute to this. Now, if you recall, the shoulder is described as having mobility at the expense of stability, and therefore relies on the ligaments, tendons, and muscles crossing the joint for stability. In order for the shoulder to remain strong and mobile, the surrounding muscles must be able to work synergistically with each other to provide the stability and control. Key muscles that are required for optimal shoulder health include the rotator cuff group, the trapezius, in particular the lower trapezius, and serratus anterior. Additionally, having an optimal thoracic curvature and optimal resting position of the humerus is vital in the overall function of the shoulder. Whilst rehabilitating a shoulder can be a daunting prospect, just know that it's not a complicated one. Firstly, it is important to work on the shoulder stabilizers, the ones that control the head of the humerus and the scapular stabilizers, such as the serratus anterior, the trapezius, and the rhomboids. Some examples of exercises that you would use include shoulder external rotation or prone football flies. From here, the client can progress onto more functional movements such as a single arm shoulder press, in which the shoulder is challenged not only from a load perspective, but also from a complexity perspective. Remember that when you are dealing with your clients, the chances are very high that although they want to be rehabilitated, they are also wanting to achieve their other goals. So give them what they want and what they need simultaneously. You could use some of the rehabilitation exercises as precursors or warm-ups for the working set. Think back to the Find Fire fatigue strategy that was discussed previously. A scenario such as this is a great opportunity to put that concept into practice.